Dr. Edward Lanieski, board certified orthopedic surgeon at the Orthologic Biologic Institute seminar in Chicago, McCormick Place. I'm here with Dr. Paul Tortland. He's with the New England Stem Cell Institute in Connecticut. We've known each other formally for a while. Number of years. He's a well-known expert that's spoken at a lot of different organizations and events, and highly respected. And we're going to go ahead and ask him a couple questions about what is the most important issue in cell therapy. So Paul, why don't you tell us what you think is the most important issue in cell therapy right now?
That's a really great question, Ed. And when you first asked it, my first thought was, how could I boil down all of the controversies in cellular medicine down to what I think is the single most important? But in terms of thinking about this from the public's perspective, my role as a physician is first and foremost to do no harm to the patient and to make sure that any product that we're delivering is in fact what it is that we say it is and being delivered for the right reason. So in thinking about your question, my answer is the single most important thing is unscrupulous providers providing treatments that are being marketed inappropriately. And for example, there are clinics and providers out there who are injecting amniotic fluid and placenta-derived fluid and marketing it and telling patients that these are stem cell treatments, when studies have shown there are absolutely no stem cells in amniotic fluid and placenta tissue. And the poor patients are being subjected to these potentially sham treatments and expending an incredible amount of money on these types of treatments and not getting what they think they're getting. And that makes it harder for those of us who are doing really good, responsible medicine, because now the patient comes to us and says, I spent a lot of money, I did a treatment, it didn't work, and now we're in this unenviable position of having to say to them, I hate to tell you this, but the treatment that you paid for was not the treatment that you thought you got. And it was provided by somebody who was not trained in regenerative medicine. Simply injecting a stem cell into a joint is not a regenerative medicine treatment. Our job as physicians is to evaluate the entire patient, the entire joint, the entire tendon and everything around it, and to treat it. And when you have people who are just trying to jump on this regenerative medicine bandwagon for a profit motive, that really does a disservice to the patient, and it does a disservice to those of us who are trying to do ethical, responsible medicine. And so I think that's the biggest issue right now in cellular medicine, more than anything.
Well put, very well put. And I agree with you. Just picking up a syringe, and that person who's usually doing this is not even picking it up, he's hiring someone to pick that up, and injecting that into your joint is not medicine. That's just giving somebody an aspirin and saying you're going to get better. As we were both trained in the osteopathic profession, that we have to treat the whole person.
Correct.
And you're just not a knee, you're just not a shoulder. You're a whole human entity, and you have to treat all those, because we know that it's just not the cell-based things. It's a whole bunch of other things. It may be nutritional deficiency. It may be muscle weakness that they have, or lack of range of motion, alignment of the joint, that we're all trained to do that, because this is our business, that we are trained to look at the whole person, at the whole milieu that's causing their disease and trying to treat that. So I think you're exactly correct. And what do you think the solution is then to that? What do you think we need to do to solve that problem?
Well, any complicated problem is not going to have a simple answer to it. I think first and foremost there needs to be, and I really hate to go here because I'm not a big government person, but I do think there needs to be more oversight by the FDA on clamping down on these clinics that are promoting claims that don't have a basis. You know, for example, saying that you're doing a stem cell treatment when all you're injecting is amniotic fluid. And let me back up for a moment. I'm not saying that amniotic fluid and placenta tissue and some of these products don't have value. They may. They are not stem cell treatments. Yeah. And if they are being administered by a nurse practitioner or a PA or any other provider who's not trained fully in regenerative medicine, that's not an adequate treatment. So I think first and foremost there needs to be more FDA oversight clamping down on these clinics making fraudulent claims. Secondly, I think there needs to be better methods for training physicians in regenerative medicine. For example, right now, there is no residency program in regenerative medicine. Anybody can pick up a needle and start to do injections and claim that they are regenerative medicine specialists.
And an expert in it.
And an expert in it, exactly. And again, which makes our job harder. You and I have been doing this a long time. We're leaders in the field. How do we communicate that to the patient? So the second aspect, aside from government regulation, would be setting up either training or vetting programs where an organization or a professional society could somehow certify that a physician is properly trained in doing these techniques. And until we're able to do that, it really is the Wild West out here.
And weren't you one of the first physicians to be certified in regenerative medicine?
Right, so there is the American Academy and Board of Regenerative Medicine, and I sat for their very first certifying exam. And this is kind of a funny story. I was the first one to finish the exam, which meant that my exam got scored first. So technically, I am the first person in the world certified in regenerative medicine. And just as a little boasting, I scored the highest on the test. But the problem is that organization is not under the auspices of the AMA or the AOA. And so in the grand scheme of things, yes, it's important, but it doesn't mean as much as if the American Medical Association or the American Osteopathic Association got behind it with a true board certification.
I 100% agree with you on that. I've already looked into this. They can do a certificate of proficiency, but board certification is a whole different animal. But at least we'll go in that direction, that they have to have some basic training in that and be able to demonstrate that they know what they're talking about so that patients get exactly what they think they're getting.
Right. Well, take sports medicine, for example. If you go through a sports medicine training program, you get a certificate of added qualification, a CAQ. We could easily implement something like that for regenerative medicine. Maybe not easily, but that would be a goal, where you could get a certificate of added qualification that's recognized widely by your peers, not just in a small niche organization. And that's a lot easier than a true board certification to accomplish.
Well, I think, Paul, you've given us some really good thoughts here. He's been in this field for a long period of time. He is the first certified regenerative medicine with the highest score.
For what that's worth.
And it's a pleasure being here with you.
Likewise.
It's a pleasure knowing you. And I hope that we can work together in the future because these are your cells for your healing. And if you're in the Connecticut area, and you need regenerative medicine, this is the guy to see.
Thank you, Ed.
God bless you.